Guyanese. I am Dr. Karen Gordon-Boyle, Deputy Chief Medical Officer. Thank you for joining today's COVID-19 update. The situation in Guyana as of the 4th June 2020 is as follows. As of today, of the 20 tests done, there are no new cases. Our COVID-19 deaths remain at 12, and the number of confirmed cases, 153. To date, the total number of persons tested is 1,719, with the total number of negative cases being 1,566. We currently have 77 persons that have recovered, 64 active cases in institutional isolation, 3 patients in the COVID ICU, and 25 persons in institutional quarantine. Now for the global report. According to the World Health Organization, the global statistics are as follows. The total number of cases is 6,287,771, with 379,941 deaths. In the region of the Americas, the total number of cases is 2,949,455, with 165,311 deaths. We continue to ask for the residents of regions 1, 6, 7, 8, and 9 to remain on high alert, recognizing that our neighbors, Brazil and Suriname, are reporting new cases. In the last 24 hours, Brazil recorded 11,598 cases and 623 deaths. So your adherence to health guidelines is imperative. Also, Suriname has recorded 26 new cases in the last 24 hours. Once again, the Ministry of Public Health is encouraging residents to take extra precautions to protect themselves against COVID-19. Today, we will continue our focus on the regional preparedness and response to COVID-19. We have with us today Dr. Serdel Makwat, Regional Health Officer, Region 3, Essequibo Islands, West Demerara. Here is Dr. Makwat.
Hello everyone, I am Dr. Serdel Makwat, Regional Health Officer, Essequibo Islands, West Demerara region, and I'm here to give you an update on COVID preparedness activities, preparedness and response activities within this vast region. Within Region 3, we will have commenced our activities 2 weeks prior to the 30th of March, when we would have launched our regional, the REHOC. Our REHOC is a body that meets every 48 hours and comprises of the main stakeholders, the China Police Force, Child Protection Agency, the Department of Education, the RDC, the NDC, and other stakeholders, private sector, etc. At that point, we would have discussed our main challenge, and that was keeping with the PARD document, with the plan of action for regional development and the comprehensive program in terms of health response, which is tailored for the West Demerara and the Lenora Comprehensive and Diagnostic Center. Carefully analyzing these documents, we will have come up with, firstly, having our checkpoints being monitoring. And our checkpoints are the Vredenoak and Perica Stellings, Ubu, which is the southern side of Perica, and the Demerara Arbor Bridge. And I stress the word the main, there are many others. At those points, screening will be conducted. Testing capacity, while mainly we depend on mobile testing, testing is being done for patients at our main facility, which is the Western Regional Hospital. Apart from that, we will have had testing done in Perfect Harmony, mobile testing that is, and in Cornelia, Ida. In our future projection, we'll show or discuss what are the other plans are. In terms of the main framework of COVID activities are being conducted in terms of screening activities at the main facilities within the region and all other facilities, starting with mandatory triaging at the entrance gate, followed by a triage 2, and then subsequently our step down care unit, which is used for quarantine/isolation. The procedures to follow is simple. On accessing any facility, there will be a questionnaire to follow. Infrared guns will be applied in terms of temperature control, and based on persons fitting the criteria of a probable or suspected case will now move to triage 2, where imaging and laboratory testing will be supported. Subsequently, a person can be diagnosed with health promotion activities being administered or COVID testing activities, and subsequently being moved to our isolation/quarantine area. This program is tedious in terms of the point of care that our healthcare workers needs to apply. We've been doing this all the day in and day out, and we would have seen some favorable responses. To date, Region 3 would have recorded 14 cases. Our new cases are the constant, and this is based on our health promotion activity foremost and the rigorous screening activities at all points. Region 3 is also recorded being the first point of care to render services, clinical services, since the relatives of patient 0 was housed in our facilities. And since then, we've been providing care for persons with COVID-19.
Thank you, Dr. McQuat. We must commend the work of the health team in that region, recognizing that they have been one of the first regions to participate in the COVID-19 response. We must also thank the agencies that have come on board as well as the residents. It is evident that with adherence to the guidelines put forward by the ministry, the ability to contain this disease is possible. Fellow Guyanese, the United Nations High Commissioner for Refugees has donated 48 prefab housing units to the government of Guyana to help in the fight against COVID-19. Region number 5 is the first to benefit from this initiative that will greatly assist the regions in their efforts to cater for patients affected by the coronavirus disease. These units will be set up in every region with special attention to the very remote locations. The Ministry of Public Health wishes to publicly acknowledge the donations and expresses its profound gratitude to UNHCR and looks forward to future collaborations. We also want to remind persons who have underlying conditions, our pregnant women and parents, to ensure that you make contact with your nearest health facilities to maintain your clinic schedules. It is important that your conditions are controlled. We continue to encourage all gynaes to utilize the services available to you and call the hotline. Make contact with the health facility nearest to you or visit one of the COVID-19 facilities if you are experiencing any symptoms of COVID-19 or if you have been in contact with someone tested positive. We are all in this fight together. C. Curfew measures you must respect. O. Observe cough and sneeze etiquette. V. Vigilance is important for you and for me. I. Isolating when unwell is the key. And D. Distance yourself 6 feet apart to stay COVID-free. Take responsibility. Fight COVID-19 as a community. Thank you.